the month of July, we have completed more than 295,000 tests, and for the additional tests that have been administered in the month of July, that's actually #1 in the country. And I say that to let people know we're working really hard, because testing is critically important to know how much COVID we have, where it is, who's got it, identifying contacts, and making sure these people isolate and so forth, and that we can do what we can to allow them to stay home. But we obviously are not doing everything that we would like to do, and we're going to continue to do everything we can to further surge our testing capacity in Louisiana and to reduce turnaround times on those results to make our contact tracing more effective in isolation and so forth. Since July 6th, a total of 20,577 Louisianans have visited one of the HHS surge test sites here in the Baton Rouge area. And there are 4 of those that are principal sites. We have some mobile testing that's part of that effort too, that moves around, but the 4 fixed sites are at the F.G. Clark Activity Center on Southern's campus, Alex Box on LSU's campus, Cortana Mall, and then at the Lamar Dixon facility out in Ascension Parish in Gonzales. So we've got some good news on that, that we have 60,000 tests that were made available from the federal government for that effort. Those sites were scheduled at one point to close on the 18th of July. They're going to remain open now until we use all 60,000 of those tests. And we are also going to be able to deploy beyond the Baton Rouge area, get into Acadiana and Lake Charles areas as well. More information about those specific sites will be coming up. But I do want to encourage everyone to take advantage of this free testing. Results come in within 2 to 3 days, and you do not have to have a symptom. You do not have to have a contact with someone who is COVID positive. Anyone can get a test just because they are worried that they may have COVID. So I'd encourage everybody to take advantage of this opportunity. You can go online to doineedacovid19test.com. doineedacovid19test.com, and then you can pre-register. Although pre-registering is not necessary either, you can just show up and be tested. Today, we are also tragically reporting 24 new deaths, bringing the number to 3,375. With respect to hospitalizations, we added 32 individuals to the hospitals since yesterday's report. We're now over 1,400 individuals who are inpatient at hospitals across the state because of COVID-19, and that is up considerably since mid-May. In fact, it's more than double since then. So we've got some work to do, obviously. The numbers bear that out. And speaking of numbers, we thought you might benefit today from hearing some data from the private sector. So Samesh Nigam, who's the Senior Vice President and Chief Data and Analytics Officer for Blue Cross Blue Shield of Louisiana, is going to come up and present some information to you all and talk about what their data is revealing. And then when he completes his presentation, I will come back up and finish up my remarks as well. Samesh.
Thank you, Governor. Thank you for inviting me to talk about this very deep partnership with Louisiana Department of Health that Blue Cross Blue Shield of Louisiana has developed. In fact, the partnership started even before the first case was announced in Louisiana. I recall seeing in our data COVID-like illness, pneumonia without flu sort of spreading all over the state. The first day when Governor and Dr. Bu announced the first case early in March, we were able to very quickly see a cluster around Lambeth House, which was the first cluster. And since then, that partnership has grown. We very quickly signed an agreement. We are sending all of our data to LDH. Lee Mendoza has done a fantastic job of getting all the data from different sources that they've supplied to us, and we supply all of our data that we have to Louisiana Department of Health. And interestingly, we are able to fill the data gaps for each other. So for example, we have sources of data whenever hospitals and institutions want to admit somebody. So, there have been some question about quality of data, and I want to assure you that from our eyes, of course, as a payer, we pay, more than $300 million per month to healthcare services. So this data is looked at very closely, and that data that's coming to us for authorizations, for inpatient admissions, for example, or admission, discharge, and transition notices that we get daily from the healthcare system, both outpatient and inpatient. It's very closely tracking the data that LDH has published out for public for everyone to use. Very high quality data. Honestly speaking, we can't say that for some of the other states around, but we certainly can rely on the data that we have here at LDH. And indeed, we saw that initial peak that right after the first case, you already recall that peaked sometime in late March, early April, and then it started coming down. The school, we modeled the data as well, so we saw declines because of school closing and stay-at-home orders, and we were all tracking really nicely, just like New York, and everything was going in the right direction. We were very happy about it. Our NOT values that you probably have heard about were coming down, but after reopening, we of course have seen the resurgence, and that's shown in LDH data, and that's also shown in Blue Cross data. So in fact, we are back up to the number of inpatient admissions that we were seeing at the peak. And our outpatient numbers, these are people who are actually coming to the healthcare system, to outpatient clinics with symptoms, they have actually now exceeded whatever we had in the earlier peak. So clearly a situation that we need to be very aware of and do things that make all the difference. We in fact saw, curiously, when the masking guidelines came out from CDC, an immediate decline in the rates. So that's something that was very gratifying to us, that the data also showed that when you start using masks, the numbers decline. I know that's what we are trying to do again to solve for this resurgence, but my hope is that everyone will follow the universal masking, and in fact, that will help us get the disease under control. I really want to thank Alex and his team. They've done a fantastic job, and Governor, for this very data-driven approach that you have taken. Its strategy in Louisiana is driven by science. My career mostly was spent in the Northeast and New York and Philly area, but I can absolutely with pride say that Louisiana leads the country in this very strong private-public partnership and with the data we have. So from that perspective, we are ahead of the game. We need to apply the data. We need to make sure that we're doing all the right things. And I'm very confident that together we'll be able to defeat the disease. So thank you.
Thank you, Samesh. And I will tell you, Blue Cross is, if you don't know it, they have the largest market share in the private insurance market in Louisiana, but they're also one of the managed care organizations in the Medicaid program. So they have more data than any other insurance company in the state of Louisiana, and they have a very sophisticated operation. So both from a quantity and a quality perspective, the information that they have is very helpful. And I want to thank Samesh and all the folks at Blue Cross for the work you're doing, but also for providing that data to the Department of Health so that we can then just check and make sure that what we're seeing is in fact accurate. So from those numbers, you can see we still have a lot of work to do. We should start seeing any day now, I suspect, any impact to our numbers from the 4th of July weekend, and I do want to prepare people that there's no real reason to expect that over the next several days or couple of weeks, really, that we're going to see better numbers. I hope and pray that we do. But there's always a lag time between when behavior changes and when that shows up in the numbers, whether it's for good or for ill. Which brings up another point that we talked about a lot at the outset of the initial pandemic and the case growth. and that is, it's the nature of a pandemic. If you wait until the numbers show that you're imminent in terms of overrunning your capacity to deliver health care, you've waited too late. This is like a huge ship, and you've got to start turning it long before you would think is necessary in order to get it pointed in the right direction before it is too late. And that's something that we've been learning from the folks at the White House Coronavirus Task Force and a lot of other experts as well. Today is the 4th day of the new mask mandate and the other measures that we put into place. We signed the order on that on Saturday. The order became effective on Monday. Mask mandates, closure of bars, and the further limits on social gatherings. I'll tell you, the State Fire Marshal continues to educate businesses and others on their responsibilities and to respond to complaints from members of the public who are concerned about their safety when they're out and about. And I do want to spend just a moment directly addressing the Attorney General's opinion from yesterday. Let me just start by being very clear on this point. The order that I issued on Monday is in effect. It is binding. It's mandatory. Nobody should be confused by the opinion that was issued yesterday. And I will assure you that those measures that are contained in that order are necessary to protect public safety and promote the welfare of the people of Louisiana. And they are firmly based on the authority that I have in Louisiana law, based in the Constitution and statutory law as well. And I will also direct some comments to businesses across the state of Louisiana. One of the things that the legislature paid particular attention to recently was trying to make sure that civil liability was limited. In fact, there was immunity provided to businesses across the state of Louisiana with respect to employees and customers who might claim to have contracted the disease on their premises and so forth. And that immunity was granted in several bills that I signed into law. But all of that immunity is contingent upon the businesses following the guidelines of the CDC. And if you don't honor those guidelines, then you run a very real risk of not having the protections that the law affords you with respect to those liability limitations. And so I think the Attorney General's opinion was wrong on many fronts, but every front actually, but it could also cause confusion to business owners in a way that would potentially cost them a benefit of the laws that were passed just recently. And I'm asking that people comply, and I guess when it's in a mandatory order, it's more than asking. But whether you comply because you are worried about losing your immunity, or whether you do it because it's the right thing to do, and I assure you it's the right thing to do, whatever your motivation, just need people to follow the rules. Dr. Birx was very clear on Monday, publicly and privately. Given the amount of COVID in Louisiana today, how widespread it is, with, by her information, on Monday, 44 parishes having positivity factor of more than 10%. We know that 61 of the 64 parishes have high incidence rates of COVID cases of more than 100 per 100,000 over the last 14 days. That the only way to get back on top of this virus without going back to a stay-at-home order or to phase 1 is to have a universal mask mandate, to close bars, and to limit gathering sizes. That's precisely what we did. It was sort of fortuitous that that became effective on the day of her visit. So just want to encourage people to understand where we are. We've got a lot of work to do. Everybody has a role to play. Yesterday, we launched the Frontline Worker Fund. We've already received, as of just before I walked in here, about 125,000 applications. We should surpass the 200,000, and that's the cap on how many of these $250 awards that we can actually make before we exhaust the funding that's available for it. But we should exceed that 200,000 either today or tomorrow. So I am encouraging people to apply as quickly as they can. We do know that the $250 in terms of the monetary amount isn't enough for these people who kept working and made sure that society kept functioning and that the most essential things were available to the people of Louisiana, but it is what we can afford. It's what the legislature chose to do with $50 million of CARES Act funding. So if you've not yet applied and you're an eligible frontline worker, and to find out whether you're eligible, you can get more information online as well. And we do encourage you to apply online because that's the fastest way to do it. And it is sort of a first-come, first-served program. So you can go to frontlineworkers.la.gov, frontlineworkers.la.gov to apply. We do have an announcement today on rental assistance as well. The Louisiana Housing Corporation, in partnership with the State Louisiana Office of Community Development, has created the Louisiana Emergency Rental Assistance Program to provide up to $24 million in emergency rental assistance to residents facing financial hardship as a result of COVID-19. The program is available to start taking applications today. This too will be administered on a first-come, first-served basis. The initial round of funding to kickstart the program is $7 million, which is immediately available. We anticipate additional funding soon for the remainder of the additional $17 million for the total of $24 million. We know that there are thousands of Louisiana citizens who will likely need assistance in addition to the funds that we have, and so we're going to continue to look for additional funding out of CDB Community Development Block Grant allocations not yet made to Louisiana, but authorized under the previous CARES Act, but other funding opportunities that may come down, including Phase 4 of the legislation that Congress should take up at the end of this month. And hopefully there will be some funding there for rental assistance programs as well. This program is designed to help renters who've experienced financial hardship as a result of shutdowns, closures, layoffs, reduced working hours, or unpaid leave due to the pandemic. So all of those individuals are encouraged to apply. The program can also provide financial assistance to Louisiana renters who are not current on their rent and are at imminent risk of eviction due to COVID-19. Eligible renters will have payments made on their behalf to their landlords. So these payments do not go to the renters, but they'll go directly to the landlords. The payment amount depends upon income, household size, and fair market rent prices. And so what I want to do is call up Keith Cunningham of the Louisiana Housing Corporation. He's going to describe the program in more detail. We have from the Office of Community Development, Pat Forbes, here today. He will answer any questions you might have about the funding, specific funding that has been made available for this and what we're trying to get online going forward. But I'm going to ask Keith to come up now and tell you more about the program. And then on the back side of his presentation, I will come up to conclude my remarks.
Thank you, Governor. Thank you for an opportunity to come and talk about this very important program, much-needed program, the Louisiana Emergency Rental Assistance Program. This program is done, as the Governor indicated, in conjunction with several partners. The main component of that is the $7 million originally available for this program. The program will be accessed through a 211 service. That 211 service that is currently in use to provide information can be used to access information regarding this program. There's also a website, LouisianaRentHelp.com, which will also be an opportunity for individuals who are in need of rental assistance to go to that website and begin the application process. Currently, The program is available to individuals who are at 30% or below average median income. And what that represents in the state of Louisiana is for a household of one, 13,000, all the way up to 25,000 for households of 4 or more. And again, this program is designed to help those individuals who are unable to pay their rent due to impacts of COVID-19, the closures, and the isolation and self-quarantine related to the COVID-19 pandemic. There are some individuals who will not be able to participate in the program, and I want to be clear. Individuals who are already receiving governmental rental assistance will not be applicable to this program. Individuals who are living in public housing will not be applicable to this program. But individuals who are experiencing difficulty and who do meet those qualifications will have an opportunity on a first-come, first-served basis to receive that benefit. That benefit will allow for 3 months of rental payment moving forward, and 3 months of back rental payment as additional emergency solution grant dollars are made available to the program. Again, this is an opportunity for us to help those individuals who need assistance paying their rent, but this is not an indication that an individual does not have to meet that obligation. If you are behind in your rent, if you do have issues with your rental payment, please make sure you contact your landlord. Please make sure you keep in contact with those individuals as you work through this process. Even as this program is offered, we don't want to indicate that there's any assurance against anyone having to pay their rent. That burden still exists. This opportunity is to help those who have that need to meet that burden. And the last thing I want to make sure that we mention about the program is that as it is on a first-come, first-served basis, we intend to allocate this money in a judicious fashion, very efficiently, but we're also aware that additional dollars will be made available. And so we'll try to continue to operate this program in a way to provide the assistance that individuals need throughout the state. Governor, if there's additional questions, we'll be ready to answer, but for now, that is the gist of the entirety of the program.
Thank you. And Keith will come back in just a moment. And again, if you have questions about the details of the currently available funding or what we're looking at going forward, Pat Forbes will be here as well to answer any questions that you might have about that. Obviously, Louisiana remains at a very critical stage of our COVID-19 response. We can turn this around again. We've done it once, and in fact, the Vice President remarked the other day that of all 50 states, Louisiana is the one that growth in cases to begin with flatten the curve. In this second resurgence is dealing with this, and so he too had confidence that we in Louisiana would do what's necessary in order to flatten the curve. I believe we are going to do this again, but I know we can't do it without everybody playing the part that they have to play. I do want to let you all know that every couple of 3 weeks I have the opportunity to have a conference call with hundreds of pastors across the state of Louisiana. Last week we had such a call and received a request, and I'm happy to honor today. And I know it's a little bit unusual, but I think it's something it's important, at least for me and those people on the call and many other Louisianans. So I'm going to call for 3 days of fasting and prayer for our state for July 20th through the 22nd. So that's the 20th, the 21st, the 22nd. This will be the spiritual diet and exercise that I, as a Catholic Christian, believe is very important anyway. So we'll be doing lunch fasting for those 3 days and certainly praying as well. Praying for the people of Louisiana, praying for those who are sick, praying for those who care for those who are sick, and certainly praying for the families of those who have passed on. So if you're inclined, please join me and the First Lady and faith leaders across Louisiana, regardless of your denomination or your religion. Join us in prayerful reflection and fasting, lunch fasting on those 3 days. At this point in time, I'm just going to remind everyone, we know how to be good neighbors. It's time to do that in Louisiana again. And if we will do that, we're going to get through this sooner and better. And with less people becoming sick, less people entering our hospitals and taxing our healthcare delivery system, and certainly with less people dying. We'll also do it in a way that will allow us to have more of our economy open, more of our schools open, and have as much normalcy as possible before we do fully get back to normal at some point in the future. And I'm optimistic that we can do this and that we will do it. So with that, I'm going to take your questions. I do have Dr. Biu here to answer.
People are worried that their are not going to survive this shutdown.
Well, first of all, I would tell them what I said on Saturday. That is not a decision that I wanted to make. It's very, very difficult. I do think it's absolutely necessary to protect the public health and make sure that we do, again, get back in front of this virus, that we flatten the curve and reduce the care delivery system, and ultimately we're going to save. Clearly, I don't like restricting any business of any kind, and that's particularly of shutting them down. But it is very, very clear across the world, across the country, here in Louisiana, that certainly we feel for them. We really do hope that the ability to have curbside pickup, it will be something that they can take advantage of. We know that that's not going to offer them the full range of services that they're accustomed to and so forth. But at the end of the day, very difficult decisions have to be made, and this is just one of those. Yes, sir.
Governor, over the past several days, we've talked to people who have at one point in recent days been in line somewhere in Louisiana, a lot of times in this area, to get a test. And whether the lines be too long or something else, they get out of line, leave, do not test regardless, and days later receive a call that they have tested positive when they have, in fact, not done a test at all. Is LBH aware of that? How is that, maybe taken out as positive, fake positive, false positive? What is being done to make sure the numbers are as accurate as they?
Well, first of all, that's the first I've ever heard of it. I can't answer whether LEH has heard of anything happening like this, but the good news is I have Dr. Biu here. He can come up and I assume you heard his question. Okay, Dr. Biu will come up and address it.
So thanks for the question. I'll tell you that we have heard that. It's usually, I know a person whose cousin said, that's the way that we get those questions. We have not any credible reports of that. Certainly, I think what we've seen in the last week is across social media a campaign to try to erode public trust in testing in general. I think those stories are a good example of that. I think questions that are raised about whether the Department of Health is listing cases as every positive test that's run, which is not the case. If you're a case on our board, it means that you have been tested at least once as a positive. If you're tested 12 more times, we don't add you 12 more times, you're just still that one case. These kinds of stories, I think, are insidious and pernicious and quite frankly scary from a public health standpoint, because I don't think that there is a widespread effort to raise numbers. We certainly have nothing to gain from that. What there is a risk of, though, is people feeling that testing doesn't work or that they don't want to get tested, because testing is the key beginning point to understanding your risk and the community's risk for COVID, having people know that they need to isolate, take care of their health, and for people who might have been exposed to that individual, know that they also need to quarantine. So again, we don't have any credible reports of that, but we hear a lot of rumors. And I would just emphasize, again, we've been very transparent with our data and would encourage people to reach out to the Department of Health where they have questions.
Anybody else with questions for Dr. B?
Yeah, well,
Sam.
from that, Red River Parish and also West Louisiana Parish have made essentially these claims that they have some sort of list of cases, right, and they believe there's duplicates on them. I think Mike Johnson, the congressman, actually posted about it today. So can you address that specifically, I guess the Red River Parish instance?
Sure. So early in the epidemic, many states, including Louisiana, began sharing information specifically with first responders, and it's really in the first responder systems that information is supposed to be listed, so that as people were responding to calls, they would know whether the individual that they had interacted with posed a risk of spreading COVID, kind of like an early contact tracing specific to first responders. Part of the data sharing agreement that we had with individuals was that that data really was not for somebody to just pore over and look at. It was specifically to be entered into that system so that as somebody is dispatched, they would only have visibility in the person that they're responding to. We continue that practice to this day. What I believe we're seeing from Red River Parish Office of Emergency Preparedness is looking at their data, they feel that there are duplicate cases. And I think it's probably just a misunderstanding on their part. We've changed the way that we give that data. We now only provide new cases. I think in their posting they noted that they're looking at a cumulative list. They're not. And we both automatedly and manually deduplicate, as we've talked about before, move out-of-state people out of state, move out-of-parish people out of parish every day. And when we looked at Red River Parish's numbers at the time of their posting, they did have 96 cases. And we were not able to corroborate what they feel is, I think, something as low as 56 cases. So I do think we have a call set up early next week to hopefully have a productive discussion, which was what I hope would have happened at the beginning about data. I know that there's many questions about that data, but again, I go back to the importance, especially as public officials, of giving sound public information in the middle of a pandemic and not raising undue concern. Please.
Some people who test positive before they go back to work are told that they have to receive a negative test or 2 negative tests, so to speak. So if they test positive again, meaning they still have the virus, I know that would go under test perform, but that would not be added to.
Yeah, to be clear, you are only ever a case once. So you test positive. If we test you every day for the next 10 days or however many, you may have 10 tests reported. I would not recommend that since we're feeling a pinch on tests. But you are only once listed as a case. Now, there are times, because of the way that sister hospitals may report their labs twice to us, that data may initially show up twice in our system, and that's why we have an automated system and a manual system to go through and remove anybody that's listed twice. And sometimes it's as simple as Robert being listed as Bob in the next lab. And so it takes something your computer can do and something that a human eye has to do to identify those are two people. But no, you are listed as a case once no matter how many tests you have. I do want to sort of follow up on something else you said there, which is some employers are requiring people to test negative before returning. We are strongly recommending that that not be the practice. And in fact, when the Vice President and Ambassador Birx were here, they also emphasized that. With the strains that we're seeing on access to testing facilities, it is not appropriate to test otherwise healthy people to prove negativity for COVID-19. Really, you have to be a vulnerable nursing home resident or somebody who is otherwise particularly ill that we have concern, or immunocompromised that we have concern you may not clear the virus as quickly for us to think you need to be retested. Most of the public, once positive, should be symptom-free for at least 3 days, more than 10 days after their positive test, and that is all that they need to be able to return back to work and what other engagement they do with the public. With a mask on, please.
When Louisiana was moving into phase 1 and phase 2 of reopening, there were several standards, right, that the White House laid out, like gating criteria. And I'm wondering if the health department is recommending that school districts or FESI meet that same gating criteria or different gating criteria or any sort of criteria for resuming in-person classes.
So we're not currently recommending something like that. When we look at gating criteria, we're really looking at a state policy level, movement into a phase, and potentially movement back in phases. I think even that, we're in a bit of an interesting moment where that paradigm is shifting. And you see that in the governor's latest order. We now have information and evidence from our own contact tracing, from studies done across the country, observed during this epidemic, that tell us we may not necessarily have to go back to a stay-at-home order if we can emphasize, the following things, because these were the things that seem to have the biggest impact. Ambassador Birx is working with a team at the Children's Hospital of Philadelphia, modeling, and the measures that she gave as recommendations to the state, certainly to our governor, were designed so that you could keep the economy open while apparently keeping below a reproductive number of 1. We haven't seen that data. I can't corroborate that, but that's the way that it's been explained to us. And so what I would say going forward for schools or whoever else is that as we have specific information, whether it's the risk of bars, whether it's the benefit of masks, that I think is important for them to operate on. And certainly there's always the risk that as a state, if our numbers in our hospitals get out of control, that would be something where we would need a cooling off period. But to be clear, we now are in a situation where we can act on best evidence. And I know I'm going long on this, and the last thing I'll say about best evidence is just this week the CDC released a study about mask wearing, highlighting the work of 2 hairstylists in Missouri, both of whom were actively shedding COVID, unaware of their status because of a turnaround time on tests, both of whom, according to Missouri rules, wearing masks, and all of their clients wearing masks. And over the course of 8 days of cutting hair together, they interacted with 136 different individuals, including coworkers, as well as people whose hair they cut. Not a single one of them went on to get COVID. I cannot underemphasize the importance of wearing masks. The CDC and the federal government and even the White House are now very clear that there's a reason we're saying wear your masks. It is going to make a difference between you potentially exposing somebody or being exposed. Right.
Be a little bit more specific. I know you don't want to give locations, but in terms of colleges, are we talking about staff or students getting infected? Are we talking about people in the athletic department, in a lab? I mean, the reason I'm asking is because I think when you say bar, I have a pretty good idea of like that type of setting. But college, are these people on campus when they're getting infected, off campus?
So it's a good question. I do not have that specific information, but we'd be happy to follow up with you, and we can talk with our epidemiologists and get that for you.
When you're talking about discouraging employers from using, from requiring tests for people to go back to work, then why are we encouraging in Baton Rouge these federal surge testing sites for anyone who has no symptoms to go and get tested if we have a testing shortage? Wouldn't we want to prioritize those tests for people who are either first responders or people who have symptoms?
So in the Baton Rouge surge testing sites, there's a specific emphasis being placed in Baton Rouge on trying to suppress both symptomatic and asymptomatic spread. That's what the federal sort of setup of that system is. They've given us the access to the test. They're driving a lot of the protocols that we're using. So it's a unique situation there. I think what I'm saying more broadly is that in other parts of the state, especially places where we're seeing high numbers of cases and maybe limitations on the specific specimens that are able to be processed in those areas. I'm thinking of like the Lake Charles area and other parts of the state. We don't want to encourage unnecessary testing. And what we've done in the Office of Public Health is essentially a tiered listing of different categories of people who could need tests, very similar to what we had in the early days of the epidemic. We don't want to have to dial those back, but we develop that so that if we do have to, in specific regions or specific areas, make sure that there are adequate tests for very ill people in the hospital, for first responders, things like that. We're not just doing that without a system. We have a system where we can sort of dial up and down based on access to testing. We, after the conversations with the Vice President and Ambassador Birx, are hopeful that we've got some strategies that will help us once again see more testing access across the state and allow us to be in a situation where we really can test all comers as we've been doing. But we have to be cognizant of, if we are in a situation where there's constraints, making sure that we prioritize tests for those people who most direly need them. Yes, please.
Is there any group of state workers that's being tested on a regular basis so that you guys can have mass testing?
So I believe people who are working in congregate settings, for instance, we operate, the state Department of Veterans Affairs has veterans homes. They are testing their staff, just as we're recommending that all nursing home staff be tested, and as is the federal government. So I think they at least are being tested relatively frequently. I don't know an exhaustive list of everybody who's being repeatedly testing. We have staff in our state facilities as well, the Department of Health's state hospitals that are also in a cycle of retesting as well. Maybe the last question for me.
What is the current R0 value or rate of spread? And at one point it was below 1. What was the first peak? What was it
So I don't have an answer for you on that. I'll say, you know, the R values that we track, the reproductive number, how likely it is that any one individual, or how many new individuals will become infected by a single individual that's infected, is going to be managed by a lot of different factors. And just as you heard the governor say, that data is going to lag the actual implementation of policies. So I don't have an answer for you on that today. But we do have data that's a little bit more timely in the forms of cases and symptoms, and that's driving a lot of our decision making these days. Thank you.
Thank you. And I think you could see when we were saying we had an R0 of 1 or lower, you also saw the number of active cases, at least by those that we had tested, going down over time. Over the last few weeks, you've seen it going up over time. When you subtract the total cases, from the total cases, those people who are presumed recovered. So we know that we're well above 1, and that's being reflected in the cases, the positivity, and ultimately in hospitalizations and deaths. And getting back to your question a while ago, these were 3 federally sponsored surge sites across the country, where a special emphasis was made on getting into hotspots and trying to arrest those hotspots with a very comprehensive testing plan for surge capacity and testing, up to 5,000 per day here in Baton Rouge. But there were only 2 others in the country, McAllen, Texas, and Jacksonville, Florida. And only in the context of those testing sites have I seen where they said, come if you think you've got it. If you're symptomatic, come if you think you've been in contact with someone who had it. Come for any reason. And they are calling the shots on that. And by the way, we very much appreciate the fact that they're in Baton Rouge. I will tell you that the Department of Corrections routinely tests staff members as well. So we are paying, the question getting back to state employees who are being routinely tested regardless of symptoms, it's those who work in these congregate settings, and whether they're prisons, nursing homes, and the like. So, yes, sir.
Governor, a White House document, they issue these policy documents to you guys, I think, pretty regularly. From 2 days ago, the policy recommendations for states that were in the red zone for cases of positivity, of which Louisiana is one of these 18 states. Among those recommendations were for counties that have these problematic trends, close down not only bars but also gyms, to limit indoor dining to 25%, to limit social gatherings from 10 people or fewer. I'm wondering, your decision obviously was less stringent than those recommendations. Can you address kind of why yours didn't go that far, or whether we might be headed in that direction?
Well, I think the chronology of the events that you just listed in your question explain. Those guidelines came out after I announced the decision.
So are you planning on following those guidelines in the coming days?
Well, we're going to take a look at them like we always do, and see whether we believe those things are needed. I will tell you, everything that we've done thus far has been consistent with guidelines we've gotten from CDC and the White House Coronavirus Task Force, whether it was the gating criteria, the mitigation measures that we put in place at different points in time. So clearly we will take a look at this as well. The things that were emphasized Monday by Dr. Burks and the Vice President dealt with masks, limitation on crowd size, and closing bars. But we will certainly take a look at these other things too, and see whether we think that those are additional steps that we have to take. I can tell you, as I stand here right now, I'm not of a mindset where we are about to impose new restrictions. You know, we are mindful that we have a current proclamation that is set to expire on the 26th, and there will be a new proclamation issued in order to take its spot. I cannot commit today what will be in that one that comes on the 26th. Yes, ma'am. Okay. All right. So, any other questions for me? I might just leave Keith and Pat and Samesh here to answer your questions. Look, thank you all for continuing to cover this. The information that gets out from you all to the Louisiana people is incredibly important. And that's because there are a lot of sources of information out there that are just misinformation, just wrong. Sometimes it's wrong, but without being malicious, and sometimes it's malicious. But the way that we combat that is to put out good information, and you all play a critical role in that. And so I want to thank you for doing that, and I want to continue to encourage the people of Louisiana to play the role that we have. Let's wear our mask when we're out of our house and we're interacting with people who are not part of our immediate household. Let's make sure that we're washing hands, staying home when we're sick, and keeping that 6 foot of physical separation between ourselves and others. And in addition to those things, I do continue to ask people to pray for our state. And again, I would ask you to join with me with a lunch, fasting, and prayer on July 20th, 21st, and 22nd. So thank you, and I'm going to leave these other folks behind to answer more questions.
So I was just trying to figure out, do you have an estimate of, so is the 24 million sure that you think we have the resources and the federal funding to cover the whole 24 million? And then do you have an estimate of how many people that are coming from able to
Of time, and based on what we believe are overall fair market rents in the state of Louisiana, and the $24 million, we see ourselves serving hopefully around 10,000 individuals over that time period.
And is there a max per month that the program will provide assistance for households?
Yes, it'll be based on fair market rents. We will not pay in excess of fair market rents as statewide.
Specific dollar amount is just tied to the local.
It's tied to the fair market rents for the area.
So let's assume it helps 10,000 people with $24 million. What is the total number of people in Louisiana who are either facing imminent eviction or just need rent help? Do you guys have a total? What's the denominator of that?
No, we don't have a total. We've been monitoring numbers and trying to understand what the potential impact would be. But currently, we do not have a large number of evictions set on any docket in the state of Louisiana. We've been monitoring evictions, and we've been looking at the national numbers. All the national trends are trending the same. We see about 87% of people still paying rent, 82 to 87% of individuals who are renters still paying their rent. We've been polling as the Louisiana Housing Corporation, we are partners in a number of different developments all across the state. We've been polling our developer and our developer community. We have not seen large issues yet, but again, we understand that a number of individual measures have been put in place, including unemployment, that have probably kept this issue from being a problem as of yet.
So does that mean when the recent unemployment that expires at the end of this month, we might be facing a more dire situation?
That's the conclusion we're drawing. To the extent that we can't predict those numbers, we're trying to prepare ourselves as best as possible for that to be the issue. Yes, ma'am.
Can I ask an Olivia question? If I'm a person who's applying and I'm paying above whatever fair market rent is, will you also give me up to whatever that fair market rent value is, or am I?
You will be. Oh, absolutely. You will be able to receive the maximum amount the program can award. And part of the program in paying the landlords or the property owners directly, it's an actual contract in which we intend in order to receive these dollars for the landlord to agree not to evict. So that's for that 3-month period.
So if I'm paying higher rent, I still might be eligible for relief?
You would still be eligible to a portion of relief. Yes, ma'am.
Sorry, can you explain if I'm a person who has three months of back rent, does that mean I qualify for up to 3 months and it covers only back rent but not my current situation? And I guess what happens if I'm 3 months late on my rent and I sign up for this program, the landlord agrees not to evict me, but I have no job prospect because it would indicate I have more money coming in to pay my rent the next 3 months?
Right.
What happens? I mean, is that person going to get evicted in a couple months when they again fall behind?
Right. So again, A lot of this program is based on available resources. We anticipate the federal government bringing rent help as a part of the next conversation, the next wave of dollars. We also anticipate that the dollars we do have will be resourced to those individuals who need it the most, that will prevent exactly the eviction from happening in that manner. One of the components is because of the federal sources that we are using, our ability to pay arrears is controlled. We do have a source coming, Emergency Solutions Grant, that will be able to pay arrears. But the dollars that we have available at this very moment will not pay arrears, but we will still be taking those applications, we'll still be taking that note, and we'll be still in a position to help those individuals address that situation.
Okay, so on that point, the $7 million that you immediately have can't pay arrears, but the other $17 million, some of that will stay.
Some of that will be available to pay back rent.
And sorry, can you just repeat where exactly the $7 million is coming from?
It's coming from a home allocation. That's a federal program, home program partnership from HUD. It's an allocation the state receives on a normal basis. It's managed by the Louisiana Housing Corporation.
And the next $17 million, it's unclear yet where that's coming from, or do you have a...
17 million, 12 million will be coming directly from the Emergency Solution Grant dollar. 5 million will be from CDBG dollars dedicated to the state in response to COVID.
So it's all federal funds.
It's all federal funds, yes, ma'am.
And applications start today.
Applications start today.
It's also a very helpful press release from LHC and from us.
And sorry, one last thing. The first $7 million, you said it was 30% or less of average income or something?
Average median income.
Average median income. So the next $17 million, is that going to get loosened to people who make more than that, or is it going to be the same income threshold?
Certain portions of that dollar can only be allocated to individuals at 30% and below AMI, but we'll be constantly monitoring how these funds are being used to try to determine if there's ways that we can improve the process and increase those individuals who are able to apply.
Have you already identified people who would be eligible that you will maybe reach out to, or is it purely going to be on whoever applies?
Yeah, we are identifying it as a first-come, first-served program. As you all are aware, we have a housing shortage in the state, and we have an affordable housing shortage in the state. So this just exacerbates that system. But we have not contacted anyone individually to make them aware of the program. We receive emails every day. People are aware of this cliff. And they've all, I believe people have been positioning themselves knowing that the state would present a program at some point in time. Yes, ma'am. Tax credit units?
Yes.
Yeah.
Are they eligible?
Yes, they do not receive rental assistance. It's a system of rent control where they do not pay a fair market level, but they do have the responsibility of paying their rent without any assistance. So those individuals will be available to participate or eligible for this program.